Kia ora koutou katoa, no mo haere mai. Welcome to the launch of the Care Report, Experiences of Digital Technology for Home Support Workers, the Need for a Human-Centred Approach. I'm Dr. Leon Salter, Postdoctoral Fellow at the Centre for Culture-Centred Research and Evaluation at Massey University. This is Lisa, my co-author on the report.
Kia ora koutou, ko Lisa Vonk tako ingoa. I am a research assistant at Massey University's Centre for Care, along with Leon, and a PhD student researching digital technology and care of older people.
Should we go around and introduce everyone? Andrea, do you want to introduce yourself?
Yeah, kia ora koutou, ko Andrea toko ingoa no tia mana o ko tipuna ke te noho o ki Poreki, ko te pukinga here tikanga mahi toku mahi. So thank you very much for inviting me. It's a great pleasure to be here with you today. And my name is Andrea. I was born in Germany in a very small town called Arnsberg, which is surrounded by beautiful hills and lots of forests, lakes, and the river Ruhr surrounds Arnsberg. It's a beautiful, beautiful place. And at the moment I live in Wellington, where I work for the PSA as a senior policy advisor. And in my different jobs, I have always focused on decent work and sound industrial relations. And I work with a number of different international organizations, but also in the public and community sector, and also briefly with university. And I'm also a social worker by training. So that work experience really gave me an insight into the importance of the environment within which people on the ground are working in, and how important it is to enable people through the through policies and legislation to give them the best possible conditions to do their work. And if you don't see me at work, you will see me on my bike or swimming in the ocean, which I really enjoy. So thank you so much for having me today and giving me the opportunity to share some of the experience of our members. So thank you.
Kia ora, thank you. Thank you, Andrea. I just want to give a shout out generally to your collaboration on this project, as well as the collaboration of the PSA. We could never have done this project without you guys. So yeah, from the inception, Melissa met us from early on and gave us some real useful guidance. And you've given us some great feedback on the report, and it's just made it sharper and much better final product. So yeah. I wanted to read a quick whakatauki to speak to these sort of relationships, which hopefully can be built on into the future, as well as acknowledge all the home support workers themselves who shared their stories that made this research and made this report possible. Hopefully some of you in the audience tonight. And so the whakatauki is ihara takatoa I te toa takatahi ingara he toa Takatini. My strength is not as an individual, but as a collective. And we're really lucky also to have Jan Logie from the Green Party here with us tonight. And I believe you're spokesperson for gender and workplace relations as well.
That's right.
Thank you very much for coming. Do you want to introduce yourself briefly? Or?
Sure. Yeah. Kia ora koutou, ko Jan Logie toko ingoa. I'm the Green spokesperson for women and workplace relations and disability and children, as well as a few other things. But they seem particularly relevant from reading this report. And I come from a background of working in the community and feel quite passionate about making sure that we're properly supporting the people to have the time to build relationship, to care for each other, and that we value caring.
Great. That's awesome. Thanks, Jan. And we've also got Care Director Mohan Dutta here with us. Thank you, Professor Dutta.
Kia ora koto, lovely to be here. Thank you, Leon and Lisa, for this amazing report. I am a professor of communication at Massey and director of care, and most of my work is on organizing for justice to secure health. So this report lies at the heart of really what we do at care. Lovely to be here.
Kia ora. How do I share the presentations? Which has got it, cool. How do I go to the next slide? Cool. So there's, the schedule for today, myself and Lisa will be just running through the main findings of the report, take roughly 20 minutes. Then we'll have some time, quick 5 minutes for any questions or comments or clarifications from the audience. And then we'll have some responses from the panelists, take about 15 to 20 minutes. You guys, Jan, Andrea and Mohan, can have 5 to 10 minutes each to discuss the findings from your own perspectives, from your own focuses. And then we'll have a general Q&A discussion after that. We've got 90 minutes scheduled, but hopefully it won't take as long as that. I know everyone's tired. It's been a long few years, isn't it? And with the we've all got to think about the events going on in Auckland at the moment and the tragic events in Whangarei yesterday. So we've got to be kind to each other, kind to ourselves. So yeah, we'll just crack into it. Put the next slide up. First off, what are home support workers? That might seem a bit of a kind of no-brainer. And I didn't know this myself before I sort of started this this project. Well, I kind of knew what they were, but I didn't really know the details of what they did in it. And it's actually it is highly skilled work. And they do a real kind of mix of different tasks, different skills, from cleaning, preparing meals, washing, to administering medication, quite specialist kind of stuff. They have to really know their kind of medical knowledge. They really have to do their research for their job. And they care for our most vulnerable communities in our society, right? Older people, people with disabilities. And the workforce is mostly women, majority women, and themselves often aging, which is due to the kind of lack of sustainability of the workforce, as we'll get onto. And they're proportionally high migrant worker. And it's historically, like other care work and other kind of female-dominated work, it's been historically undervalued and poorly remunerated, and that continues today. Next slide. So the broader systemic context is that home care in New Zealand is predominantly publicly funded but privately delivered through a mix of for-profit and non-profit providers. So it's paid for by the taxpayer, but some of these companies like Geneva and Vision West make a profit from that taxpayer money. And the clients that home support workers provide care to are allocated funding for their care on this kind of individualized way. Funding is linked to individual clients after an assessment is made of their needs, from which then a care plan is created with which tasks are required and how much time that these will take. So then that kind of results in home support workers being paid rather than receiving a salary. They get this kind of piecemeal per client pay, where they're only paid for the time that they're actually with the clients in their homes, which, as Melissa Woolley said in our first meeting, makes them effectively like gig workers, like Uber drivers, and that they don't get paid for waiting time, travel time, that kind of thing. Next slide. Cheers. And in that kind of context means that market dynamics shape the way that care is delivered. There's an incentive for these private providers to run efficient operations by reducing their pay to their workers, the home support workers, and other costs. There's been moves to centralize staff, creating things like call centers, cutting down on middle management and nurses and these kind of experts. Local offices have been closed down and sort of replaced by these low-paid regional coordinators in call centres that don't have any kind of training in health. And it creates a kind of vacuum for the home support workers themselves. They can be quite isolated. They don't have managers. They don't have expert nurses around them. So they have to kind of fight really hard for even some of the most basic pay and entitlements. And then in this context, the technology, rather than, while they say it's kind of aimed at empowering, making their lives easier for the home support workers, it's really kind of about accruing efficiency gains. Next slide. And so, yeah, home support workers are increasingly expected to use digital technology, smartphones in their work. It's becoming more and more integral to their work. Text messaging, even before the platforms, and email becoming important means of communication for both the care providers and the home support workers. But our focus in this report is that they're increasingly being required to use these apps called care apps, with functions like automated rostering, they can access client task information through them. They do their time sheeting through those, and they also do GPS tracking to confirm their location. Although we haven't quite seen the kind of Uber for care or Tinder for care, as some people have put it, that we've seen in other countries where the home support workers are fully independent contractors. That hasn't quite taken off here as yet. So that these apps are kind of, as we'll get onto, are sold as like empowering to the clients and also to the home support workers, making their lives easier. And next slide. And yeah, and articulating this discourse of empowerment, Veronica Mannion, Chief COO, Chief Operating Officer at New Zealand Health Group, which owns several large home care providers, including Healthcare New Zealand, Geneva, has suggested that automation in the home care centre will lower costs and enable staff pay to increase. And she's articulating this kind of view that it's an outdated industry that's kind of really needs this technology to improve it and bring it into the 21st century. It's a traditionally run industry. So automation can make things much more efficient, can create more money we can use to give back to our staff. So it's this kind of what we call the ideology of technological determinism, the idea that technology will make things more efficient, and will act on something like an outdated, traditionally run sector like care support and make it more efficient to benefit everyone. Next slide. Thanks. However, we kind of, in our report, we critically interrogate these claims, drawing on recent literature on platforms, such as Nick Cernicek in his book, Platform Capitalism, where he defines a platform as a digital infrastructure which mediates between two or more groups. And we've seen this with the emergence of these kind of partnerships between the tech companies like Microsoft in this example. We've got a partnership with Nurse Maud, which is quite a big not-for-profit provider in New Zealand. And they've got a sort of partnership to automate service coordination and rostering. But of course, these platform technologies are not neutral. They're not always empowering, but they're actually interwoven with economic, social, and political processes. And if they are deployed in an already exploitative system, which views technology as something to impose on workers to enable efficiencies rather than incorporating their voice, then it will reproduce and ingrain that system. And that worldview, which comes from that sort of shapes these kind of partnerships between Nurse Maud and Microsoft, is the kind of ideology that comes from places like that comes from Silicon Valley, right? While Uber-style platforms haven't made the inroads in New Zealand. The technology that gets implemented in these partnerships can still have similar impacts on their working conditions through its focus on efficiency being imposed in a top-down way. Next slide. And so you get this kind of platform, what we call the platformization of health infrastructure, where as governments pull back from investing in infrastructure and let the private sector take over, tech companies, the private sector begins to plug the gaps. And the technology cements this kind of partnership intermediary role. These providers are already kind of like intermediaries, they're already like platforms. They don't actually really produce anything, right? Like Uber. They're just, they kind of, what they do is they connect people, they connect clients, they connect to government, they connect to the workers, right? And so they kind of cement this platform infrastructure, this intermediary role, and they naturalize it and make it harder to replace with something else, like a publicly run system. And then the platform begins to become used to sort of seduce government as well, because it's this kind of, look at this kind of shiny, nice piece of technology that's going to make everything efficient and it's going to save you money, right? Next slide. And at the more micro level, there's a kind of platformization of the work of the home support worker. It cements their piecemeal pay structure, where they only get paid for the work they do in the client homes rather than getting a salary. And it reinforces that by tracking their location, asking them to sign in when they reach the client home, that kind of thing. And there's also a kind of element of de-skilling through the segmentation and breaking down of their tasks into its constituent parts. And that kind of means that the most important and most skilled aspect of their work, which is the relationship building with the clients, who are often isolated and lonely and rely on those home support workers to kind of create a relationship with them, and also builds a relationship of trust where that they can really know the client as a person and what the kind of care that they need. That kind of thing doesn't get included in these kind of checkbox lists of these that they tick off through these apps. So it kind of negates that most skilled aspect of their work. And so next slide. So in contrast to this is the human-centered approach that we're advocating for in this report, where worker participation is an integral part of digitized workspaces. And I hope I get this bit right, because Andrea has provided this part of the report. So the Trade Union Advisory Committee, or the TUAC to the OECD, recognizes the ability to improve productivity, but it must be tied to supporting and protecting working conditions. And for technology to really fulfill that potential for efficiencies, it underlines that the digital innovation processes must be based on co-design through social dialogue. So there must be transparency, clear responsibilities, and data protection must be built in, as we'll get onto towards the end, especially resonant in Aotearoa New Zealand with Te Reo Waitangi and Māori data sovereignty. And there must be rights to make adjustments to the technology. There must be things like risk monitoring and co-governance. Next slide, thanks, Richard. And that really fits nicely to what the Care Centre's co-PAPA as well, the culture-centered approach, which is an approach to report research that we've followed in this research that foregrounds the voices of those who are marginalized by structures of class, gender, race, ethnicity, ability, and sexuality. And it's a real approach from bottom-up sense-making, recognizing that historically research has been about extraction and top-down imposition of sense-making. So insights that inform the study, thus directly informed by the experiences of the workers themselves, rather than imposing academic frameworks onto those voices as much as we can. And we've tried to make sure that the recommendations of this report derive from the perspectives of those who are both most impacted by the research and by the technology. Okay, that's enough from me. Lisa, do you want to talk about the production of the report and the process and the findings?
Yeah, of course. Kia ora. Thanks, Leon. Can we change the slide, Richard? Awesome, thank you. So the report that we're launching tonight was developed based on our study, where we undertook 16 qualitative, in-depth Zoom interviews with people who are working or people that were very recently working as home support workers here in Aotearoa. It's important to note that the majority of our participants worked for quite large care providers, regional or national providers of support, and most of them worked with older people. We recruited the participants through the PSA, through the Union Face group. As interviewers, we asked questions about their work patterns, about the unpaid hours that they were working, about technology use at work, about health and safety, about COVID, and we sought their, as Leon was saying, we sought their recommendations. The interview schedule that we used was flexible. It was informed by the themes arising in the earliest interviews, and this allowed plenty of space for the articulation of rich narratives about the role of technology in the working lives of home support workers. And I just want to acknowledge just how generous they were in sharing their experiences with us. So thematic analysis was employed, which generated a set of descriptive codes for the interview data that we had, and these were merged into theoretically informed themes. Can you change the slide, Richard? Thank you. So the 4 key themes form the body of the results section of the report. These themes really work to complicate the narrative offered by some care providers that digital and platform technologies are definitely going to better ensure the provision of dignified care, that they will definitely empower clients and home support workers alike. We found that while some aspects of home support work job are made easier by digital technologies, there hasn't really been any whole-scale improvement of the working conditions of support workers, which is of immense concern. Can you change slide for me, Richard? Awesome, thank you. So to start with, we found that there is just a real lack of home support worker input into the design of the technologies and communication channels that are being used in the provision of care. We refer to this as digital frustration. Ultimately, it is this lack of input that's really undermining the potential for technologies to lead to the empowerment of workers. And there is genuinely a lot of promise for these kind of app-based systems to deliver kind of up-to-date information in real time to support better scheduling and to improve the accuracy of pay. But the thing is that this just isn't being realised in any consistent way. So many of the support workers that we spoke to did flag that there might be some little benefits, things like the simple benefit of not having a paper timesheet to fill in anymore, through to things like now being able to use automatic dictation to record their progress notes. But the more overwhelming finding that there was just no consistency in these benefits across regions and providers. And these benefits were always accompanied by these incredibly vexing instances of poor design and broken functionality. In most cases, we found that technological platforms were actually creating an extra barrier to communicating with office and clinical staff. And sometimes they made accessing workplace entitlements, really important things like leave, difficult. Can you change the slide for me? Thanks, Richard. So in this example of the theme, support worker Charlotte is describing what frustrates her most about the technological setup. She says, sometimes it doesn't work that well because suddenly they change your roster. So I can ring my clients I've had the night before and say, yeah, I'm coming. I'll see you around about 10 o'clock. And then the next day, suddenly your roster has changed and that person is now not on your roster. You don't have their phone number, so you can't ring them to say, my roster's changed, I'm not going to come now. And so they get somebody else turn up unexpectedly. So Charlotte is describing here immense frustration associated with last-minute roster changes. And this is something that I'm sure the support workers in the audience will all recognise immediately. It's something that's extremely frustrating. Charlotte plans out her day the night before and she informs the clients herself of the rest time that she's going to arrive. And I really want to flag that here, that the reason that Charlotte does this is that she's drawing on her experience. She's using her professional judgment to work in the most conducive way to ensure that the clients she's working with are cared for. The thing is that her having access to the phone number of the clients is really dependent on that client being on her roster. Some support workers even described that technically it was impossible to add numbers into the phones that their employers provided them. And this was really frustrating because it means that people can't do their job in what they know to be the best possible way, to give what they know to be the best possible service. Now, of course, there are privacy and potential safety implications related to having, client information sort of freely accessible. But the thing is that it's really worth noting that the way that personal information about clients is treated is very, very variant across different care providers. And so the reason that I want to flag this situation is that I think that it speaks so nicely how failing to include the support worker perspective in combination with functionality that just doesn't reflect the realities of care on the ground really negatively impacts upon workers and clients. Richard, can you change the slide for me? Thank you. So this experience also speaks really nicely to the next theme that's being discussed, precarity. So Charlotte, like all home support workers, is a precarious worker. And the hours that she works and the clients that she visits can vary quite wildly from day to day. As Leon discussed in our opening kind of section, home support work in Aotearoa is a piecemeal job. Support workers are paid per client they visit, and travel and mileage is worked out in ways that are very complex, ways that don't necessarily match up with the travel actually being done and the wear that's actually being inflicted on private cars. The problem here is that we find that home care apps and smartphone apps, more broadly as they're being used now, are embedding this piecemeal system. They are making it easier to granulate tasks and easy to perpetuate these insecure working conditions. It's even easier now for care providers to be making last-minute changes, which render the work that support workers doing in their day more insecure, more variable. Alongside this, though, it doesn't appear that there has been any widespread improvement in the accuracy of pay. Support workers frequently were being paid wrong, and these errors always seem to be linked to being underpaid. The home care the apps themselves find that they don't necessarily make the task of accounting for actual hours easier for support workers. Extra shifts aren't always recorded through the apps, and not all apps have the functionality to go back and check all past pay slips. This need to be constantly contacting the office is labour that is unpaid. And indeed, actually using the app itself is extra labour that is unpaid. Sometimes support workers are opting to undertake their technological tasks outside of their working hours because it just takes so long to do this that it's hindering their ability to move quickly between clients. And again, just to reiterate, this labour is being unpaid. At the same time, as Leon was saying, the way that different recording systems are embedded in the apps can obscure some of the labour that care workers are doing. Like Leon was explaining, tick box systems don't allow for caregivers to document in any meaningful way the additional support that they're doing or the observations that they're making. What this hiding this labour does is it hides the professional judgment that home support workers are using in their day-to-day work. And paradoxically, it appears that in other cases, there's very little clinical oversight of the notes that caregivers need to enter into these apps. The fact that there is a lack of any kind of oversight has implications for health and safety, as I'll speak to soon, but also disincentivizes using these and undertaking good care practices. And so this all speaks to our third theme, communication inequality. So support workers report that the quantity or the quality of the communication with their management preceding the introduction of the apps and the technologies like smartphones more broadly simply hasn't improved and is often worsening. Getting a hold of the office and getting a hold of clinical staff is a real time-consuming task. What is more, some employers are sending out really large volumes of communication. But this is one-way communication. It can be incredibly generic, and other support workers often report having very little knowledge of what's going on in their region and in their company. Further, this decrease in the need to go to the office that is associated with the apps means that there are increasingly few chances for support workers to be communicating with their colleagues outside of the spaces that the union provides them. At the same time, these apps, as has been said in the comments, they're rendering support workers hyper-visible to their employers. Care providers have access to huge amounts of information about smart workers, about where they have travelled and what they are doing. And some workers described this as impacting them really negatively, as making them feel like they were being checked up on by their staff. So this visibility leads to a culture where workers feel both surveilled and like they are not trustworthy, while at the same time, for many workers, they also feel left alone, unsupported by their employers. Can you change the slide for me? Thank you. So I'd like to read a quote here from Deborah's experience, which reflects this. She says, "As far as I'm concerned, communication has just got worse. In fact, you very seldom hear from the provider. It's difficult to get through to them. I mean, the last few times of ringing payroll, it just seems to go to voicemail. You ring, you tell them what your problem is, you expect to hear back, and the next thing, you get an email telling you what they're doing about it and what you have to do. And it's like, well, that's real impersonal. Or you'll ring the call centre and ask them to do something, or you leave a message, and it just doesn't happen. There are huge breakdowns in communication." So her experience here reflects just how frustrating communication inequality can be, and it demonstrates how it embeds precarity and increases unpaid labour. Can you change the slide for me, Richard? Thank you. And so a trend towards cost cutting and efficiency like this has led to a loss of local offices and local staff, which diminishes easily accessible support available to workers. The thing is that when workers are unable to access support, and when incident reporting is not followed up, people's lives are being put in danger, which is our third theme related to the negative impacts on health and safety. The move to call centres generally is putting staff in unsafe situations. We heard lots of incidences of people being asked to do things that they weren't trained for by people that don't have a good knowledge of support worker skills and of local client needs. Apps should be meeting this shortfall, but in our experience, they simply aren't. The information that the apps are supposed to be disseminating, things like care plans and basic information related to health and safety about hazards in houses of clients, is frequently out of date. It's often years out of date, even. So in many cases, despite these technological interventions, support workers are essentially going in blind, often despite having to fill out lots of apps while they're at client's house. They don't have access to notes that other support workers have written. COVID, of course, made these risks even more significant. On top of the difficulties support workers have accessing adequate PPE and just a general worsening of their insecure working conditions during the pandemic, home support workers often lack up-to-date information about the COVID status of their clients. Can you change the slide? Thank you. So by now, it's probably quite evident that the valuable knowledge that support workers possess related to the mechanics of providing care in the community simply hasn't yet been incorporated into the technological infrastructure of home care. To paraphrase one of the home support workers that we spoke to, working in this under-resourced, demanding job is right now emotionally and mentally battering. So what needs to happen? To ensure that new technology is contributing to a sustainable workforce and really high quality care going forward, significant improvements desperately need to be made to the overall systemic context of home care in Aotearoa, New Zealand. There are very evidently substantive issues related to how home care is funded, delivered, and accountable for. And until these are addressed, technological fixes can't make this better in any direct kind of a way. To be very clear, general working conditions desperately need to be improved alongside the development of platform technology systems in order to deliver substantive changes and workers. Moving home support workers away from the current piecemeal per client pay structure and providing them with full-time and part-time salaried roles is going to prevent any technological intervention from further embedding workforce de-skilling and professional autonomy. What's more, greater accountability and better resourcing is desperately necessary in the home support sector. All home support workers absolutely need to be provided with cars and the smartphones that they're required to be using, as well as other sundry costs like vehicle maintenance and fuel. Where required, they need to be having tablets and laptops provided for as well. And it shouldn't have to be said, but it does. Personal protective equipment needs to be provided. Can you change the slide for me? So without these systemic improvements, it's unlikely that any substantive changes are going to be delivered. Right now, our evidence is suggesting that the current technological infrastructure for home care simply isn't up to the task of providing and ensuring dignified care. Worker and client voices actively need to be incorporated into design and evaluation so that technology being used in this context is protecting the interests of all parties involved, and that the right balance is struck between data protection, the protection of privacy of clients, and the provision of up-to-date information, true real-time scheduling. As Leon said, in the context of Aotearoa New Zealand, this process also must uphold the principles of te tiriti. Ensuring that the voices of home support workers and their unions is absolutely necessary if we want to prevent any further worsening of these already fragile workplace conditions. Can you change the slide once more for me? And so the next steps of our project is to make sure that we disseminate these report findings far and wide. This is something that the general public need to know about, but it's also something that decision makers need to be aware of because we need to have this systemic context improved. And in an election year, political parties will be our next strategy for targeting. So I'll hand back to you, Leon.
Thanks, Lisa. That was brilliant. It's so good to hear the kind of the way you articulated the voices there and linked it to the kind of theoretical stuff we talked about earlier. It's so awesome. Yeah, and it was your right just to go back to what you were saying about how we can make an impact on this on election year. It was your idea to maybe do a sort of presentation of a printed version of the report to some ministers at Parliament, right? Yeah, with some photos of any, and if any kind of home support workers in the audience here that may be close in or close to the Wellington area that want to join us for that, that's definitely something a tactic that we can use, and maybe Jan can advise us on that as an MP herself. Should we just read out, because we've had quite a lot of comments from the audience. Should we just read some of these out? Are we able to get them on screen? Well, from Breeze has told me how to do it, but I can't. Are there some? Yeah. So a comment from Melissa Woolley from the PSA. just speaking to, the precarity issue that Lisa talked about, need to improve travel time and costs urgently. We're all in a cost of living crisis, right? Yeah. And that's something that we haven't quite touched on. We touched on a little bit. Yeah, you touched on it, Lisa. But yeah, I mean, the cost of running a car, petrol costs, that kind of thing. That doesn't get any cheaper. Car maintenance, that kind of thing. So yeah, there was moves to address that, but it's not enough. Yeah, and from Joeline, clients added onto rosters without notification, as with removals. Also overlook clients added without your knowledge, and their attendance times adjusted by the care coordinators to hide the fact that clients have been missed, and therefore making you, the support worker, at fault. Yeah. Same for clientele they ring you about who've been overlooked, to provide relief cover and for their visit times once again altered at the office, and so it appears we are late. And that speaks to a few of our themes, doesn't it? Health and safety, yeah, the digital frustration, perhaps. Do you want to add anything about that one, Lisa? Or...
Very much. And we have a comment from Jolene here: digital frustration. The app's simply just not working, and using prescient client time gets wasted logging in and attending to the visit. And the thing is that if you don't log in, you don't get paid. Speaks so nicely to just how frustrating and the real material implications of systems that don't work properly.
Because they haven't had the input of the workers. Any more comments? Michelle's, yeah. Likes of access, community help, yeah. Can we put that, the second to last one, Michelle's one? Yeah, this is an interesting. There's technology for Kaimahi to be able to contact the client via a mobile generated number, not personal to themselves. So yeah, so it wouldn't kind of, there wouldn't be the result of having their personal number shared on appropriate handover. If organizations had to collect the rostering and actual time spent at clients, it would contradict the funding that's to be used directly for support. Yeah, so the individualized funding model. Organizations are clipping the ticket without providing the support being funded, nor do they use the technology. You go.
Sorry to cut you. And just this comment speaks so nicely, right, to the fact that the problem here isn't innately the technology, it's the context in which that these technologies are being used, they're being rolled out, how and why particular functionalities are made possible and some aren't. That's causing the problems here.
True. And the last one from Jane, and this is a really important one, particularly, hard. It's really hard physical work, physically, emotionally, mentally, and this has been accentuated over the COVID pandemic when, support workers have been essential workers, not like most of us were lucky enough to stay in our homes during the pandemic, during the lockdowns. But support workers were providing that vital support, going out to people's homes, putting themselves at risk, and far, far worse than working with a knowledgeable. I don't know if you want to expand on that, Jane, on what you meant by that comment. In the meantime, should we move on to our three panelists? Because we've got a really great panel and we want to give them kind of a little bit of time to sort of respond from their own perspectives, their own kind of focus. Jan, do you want to go first? I don't know if you want to, how you want to kind of respond to this, but yeah, I'll let you go. I think you're on mute.
I need to, there. Kia ora. First up, I really just want to thank the PSA and CARE for doing this research. It paints a really vivid picture of a system that's supposed to be caring for people who are really vulnerable, that is not working. And I also want to acknowledge, like, I got a lot out of reading the report, and one of the things that came through for me at the beginning was where workers were saying that they, home support workers, felt like you weren't recognised as essential workers through the pandemic, and that your work isn't generally understood or acknowledged. So I want to start off by acknowledging you, and the recognising how absolutely essential this work is. Like, for people to be able to live lives of dignity when they have, whether it be mental health challenges or the experience of being disabled by our society, or they're unwell, like, they still want to be able to live as much of their life as they possibly can. And often, like, so much better to be in home, right, than be in a hospital, or even worse, in an institution. And so that your work is often the enabling that, but also the connection to the outside world for many people. And I want to, like, profoundly recognize the skill in that work that is relational. It's about being able to be that person for them. That can never be a tick box. And I was so struck by the report about the reducing of your really complex work, in some cases, to tick box tasks. That was just dehumanizing of you and your skill, and dehumanizing of the needs of the people that you are caring for. So I just, like, it came through for me really strongly. And to say that the pay and the way that this has been set up, reading it is just kind of the main question for me was, how could anybody have ever thought that paying people for piecework was appropriate for care? It just is bizarre to me, reading this report and getting that kind of complex, the picture of what's going on, to think that anybody ever thought that was okay. I'm completely sold on the need for, from reading this, the need for people to be able to have a job and to be paid for that, and have that income security, and to be able to have just the pay to recognize the skill of your work. Like, we've had the pay equity debates, but it's seeing how that's being undercut around in every aspect that these businesses can, which goes back to government's decisions, right? And that there needs to be, you know, and recognizing that people can be being paid like as little as $6 an hour for that travel time, which the report also tells us is admin time. That's that the government and these businesses are clearly transferring the costs onto you as workers, and that is unacceptable to me. And also, like, so that this does need to come with better resourcing, obviously, and strengthened accountability. I was really particularly disturbed by the sense as well of some of the pictures that were created about the outsourcing and call centering of management. Like, so that this job, which is inherently going out into people's homes, like, you need, seems to me, to compensate for the isolation that would come with that by having kind of a team environment and face-to-face support for people to be able to hold you to be safe in your work, and to be able to help you through any problems. And that communication imbalance, like, being given all of these demands that interfere with your ability to do the job and the work you have to do in your own time, and then nobody will respond to you and your questions. Like, that's dysfunction, and clearly needs to change. And so I get, it came through to me very clearly that we need to support those fundamentals in terms of security and paying conditions, and then ensure that any use of technology is responsive to your needs and to enable you to do the job of caring, which you know how that needs to be done. Clearly, the interest of the businesses is not supporting that. Rant over. It was very compelling research. Thank you.
That's so great to get that feedback on the research, and you articulated the main points really well there, Jan. Thank you so much, and thank you for taking the time to read it. I know you must be hugely busy as well, so yeah, that's awesome. Thank you very much. We'll come back to you in a bit. Andrea, as one of the co-authors of this report, and I know you've got an interest in workers' rights and the future of work. So, yeah, what are your thoughts on this?
Well, thank you so much to you two, but also to Jen for her comments. And I also want to acknowledge all our amazing members that have actually contributed to the report and are actively contributing here to the comments and the webinar. But more importantly, they are contributing to our society and the communities we live in every day. And that's just absolutely amazing. And I want to thank you all for doing that. You are valued, and we will continue to fight for improving your conditions together. So thank you for that. When I read the report, the full report, I actually thought quite a little bit about the future of care and how we can create a sustainable future of care. Because what the report is showing is that the way we are doing it now is not sustainable and won't provide the care that we need. And I think thinking about care and support work in general is really important, because one of the drivers of the future of work is demographic change. We are all getting older, our societies are getting older, and those people who potentially need care in the future need to be looked after, and we are not seriously considering how we can do that well. And I really strongly believe that together we can shape our communities, the future of our communities, and the way we live, and create inclusive communities within which everybody can continue to thrive, regardless of their age, regardless of their background. And I think unions, employers, and also government are important stakeholders here that can together turn that vision of dignified living and dignified working into reality together. And just in terms of the working conditions that are needed for a sustainable care future, I think it became very clear through your report what is happening at the moment, and that the opposite needs to happen in order to create sustainable care. And we need to get on with it now. We are working at that actively every single day, but I think we need to do more, and we need to prioritize, I guess, the investment in care through really truly valuing, supporting, and training our care and support workers. And that means, for example, we talked about it in the presentation, and it came through the comments as well, that we need income and job security. We need shift work with stable hours that actually guarantee a regular income as well, something that people can plan with in order to feed their families, in order to plan for other expenses, or even just a short holiday. I think it's absolutely essential. Workers are often under pressure, we mentioned that as well, and which creates health and safety risks for them, but also, of course, for the people they are serving. And those low rates in pay and other insufficient working conditions, which don't enable people to do the best work possible, will make it really hard as well to retain people and to attract new people, which we need due to the demographic change that I briefly talked about. And most importantly, I just want to highlight that workers know what is needed to deliver high quality services, and they know what is essential to change in order to do that. And therefore, we need to create conditions and structures that allow worker participation and take worker voices seriously. And that is one of the crucial points that the report also made in terms of creating human-centered technology that is truly based on human beings, has human beings firmly in mind when designing technology. And when I was thinking about, the 3 principles of human-centered technology, I thought principle number 1 is involve people. Principle number 2 is involve people. And principle number 3 is involve people. That's how you get the best results in terms of working conditions, but also in terms of the services that you're delivering, and in terms of providing effective and meaningful services. I just want to briefly talk about resourcing as well, because we mentioned that briefly. We absolutely need to commit to resources to the care sector, and specifically to home support. We recently made a statement for the need to greater investment for home support workers, to implement the winter health plan that the government recently announced. And we are all aware that the overall budget will be announced next week. And that will be another indication how much we value care and how we walk into the future. The sector is also badly understaffed and, as I mentioned, underfunded and poorly paid, and we really need to change that. The lack of investment, also doesn't support the goal to create a truly integrated health system, which is one of the primary goals of the health reforms that are currently underway, to really ensure that regions and communities can work seamlessly together, and everyone is valued for the part they play in moving the walker forward. And concretely spoken, home support workers need equipment. We've seen it in the chat. Often people don't have the required phones or needed data to connect with the employer, to connect with clients or other workers. They use their own cars as well. That needs to change. And we also, throughout COVID, but this is a continuing issue, we need sufficient PPE for our workers, but also not just to keep them safe, but also to keep the people safe they are supporting and caring for. And we expect this to be provided by the employer, like other employers provide equipment to workers in terms of, for example, computers and office space. So I probably leave it here, but thank you very much for the report. It is a great research base to advocate for better conditions in the care sector and specifically for our home support workers. And thank you again to all our members who are joining us tonight and who contributed to the report. It is fantastic work, so thank you.
Kia ora, thank you so much, Andrea. It's wonderful to hear both you and Jan speak to the themes in the report. And I loved how you just reiterated there the three most important principles of human-centered technology: people, people, people. And just to highlight a comment from Melissa here, in the comments, she says, good experienced people are leaving the sector due to poor pay and poor conditions, which speaks to just the immediacy of making changes here.
Cool. Should we go to Mohan? Yeah, Mohan, care director, and he's worked with migrant workers in Singapore and also, Māori communities here in Aotearoa. Do you want to give the care response to this report, Mohan? Thanks.
Kia ora, Leon and Lisa. What a powerful report you have created, and there is so much to reflect on. I want to thank you, Andrea and PSA, for this collaboration, and thank you, Jan, for joining us and offering those insights. I want to begin by acknowledging the home support workers, your essential work of care. Your care labor essentially forms the infrastructure of Aotearoa, and Jan, thanks for highlighting that. I will keep my comments really to the concepts and then connect to perhaps some potential points about intervention that pick up on what Jan and Andrea have been articulating. The first thing I want to say is the ways in which your report highlights the concept of communicative inequality, which is a key concept that drives the culture-centered approach in our work at CARE. You demonstrate how automation is intertwined with communicative inequality, and particularly the erasure of worker voice, the erasure of the voices of home support workers at each of the steps of the process. And this, is the crux of the processes of dehumanization and the ways in which technologies work to dehumanize human labor and the nature of care work. So this reductionist approach to technology fundamentally depletes care and is antithetical to the organizing work of care, and it reorganizes the whole notion of care around masculinist reductionist logic. So that piecemeal nature of work that you talk about, that fundamentally goes against how care work is actually done. So in your report, I see an invitation really to think about how we reorganize technologies on ethic of care and what those imaginaries might look like. I also am particularly drawn to another concept we talk about quite a bit at our center at CARE, which is this notion of communicative inversion, which is, taking material reality and turning it on its head through communicative devices. And right, this is at the heart of the neoliberal transformation, if you will. One of these is the logic of efficiency. And as I kept reading your report, the thing that was most striking is how inefficient is the system actually, right? So we need to interrogate this idea of efficiency, interrogating the notion of cost savings, which often drive these so-called digital transformations, interrogating the notion of recency, that the technology somehow gives us updated and most recent tools, while what you have been demonstrating is that some of the systems that are in place are the really antiquated systems that have been replicated, outdated information, like you pointed out. We also, I think, within that context of communicative inversion, really need to interrogate the growth of the professional managerial class, that forms this entire neoliberal transformation on the logic of efficiency. And within that, particularly the culture of cover-ups and lack of accountability. It seems like the managers and the professional class are not accountable. They are not held accountable by any standard, while simultaneously precarizing the care worker, over surveilling care workers who are delivering and doing the actual work of care and are continually being devalued. And this sort of shapes, when I look at your work, this notion of communicative breakdowns and digital frustrations, the increased labor and time doing work, but which is actually not care work. So it's like distracting workers from doing what they are here to do in terms of building relationality, building care, to actually doing other things in order to suffice the technology and fulfill the logics of professional managerialism. So this, to me, looking at your report, serves this notion of expulsion of care, like care is expelled ironically from care work, from the organizing of healthcare. Expulsion of relationality. It's as if relationships don't matter, right? This notion of changing the client roster all of a sudden. And it's almost as if it is done that way so that relationality is expelled. And simultaneously, workers become discardable, the discardability of workers. This is, Leon, you talked about our work in Singapore, where we see, sort of this kind of authoritarian neoliberalism and how it treats workers as dirty and discardable. And it's quite powerful to see the same kinds of logics organized in the context of care work in Aotearoa. And that shapes then the most recent comment about expulsion of good, experienced people from the care space. The other point I wanted to bring up, which to me is quite striking, is the NGOization of service delivery, which actually fits into the growth of the professional managerial class, which is, I would argue, part of the neoliberal transformation. So we need to look at the NGO, private sector, state collaboration in that sense, particularly in terms of how the services and service sectors are organized around the professional managerial class. So NGOs draw on the rhetoric of community, often co-opting the idea of community, but following the same kind of instrumentalist managerial structures. So NGOs have their CEOs and COOs that are running those operations, who actually come from the professional managerial class. And there is a revolving door between the private sector, the NGOs, and the public sector, while actually continuing to precarize the working classes. And this narrative then that NGOs will often draw from, which is the narrative of community. So we need to really interrogate, what does even community mean when NGOs use that term, particularly those that are receiving state funding? What does community engagement mean? What does innovation mean? What does it mean when the health reforms talk about community initiatives? So is it really a community of people thriving in everyday contexts, or a professionalized NGO class that is organized to deliver to a community? And we need to think about the proliferation of the CEO, COO kinds of structures in the NGO sector, which continue to strengthen the professional managerial class, which one might argue actually goes on to undermine community while simultaneously co-opting community. Finally, I want to come to some possible solutions and ways of looking forward. I love your idea of this notion of how you strengthen by looking at security, and Andrea, your notion of foregrounding income security. Also think we need to think about how we look at the raced, classed, gendered context of organizing. You mentioned that the sector has a large number of migrant workers, for instance. So that immediately draws attention to the nature of precarity and migrant work and the raced context of migrant work. I would love to see more of that in your report and your work going forward. How do you foreground migrant voices? How do you foreground those kinds of intersections, particularly those that look at racism and precarity? Imagine the kind of precarity one might feel as a migrant worker within this particular space, and how that connects to disenfranchisement and exploitation. What does it mean to center dignity in the organizing of technology and care work? What does it mean to center labor rights as the basis for organizing that work? And how might we go about strengthening our unions in this process? What is the linkages between unions and politics? This is something I wonder about. How do we continue to support those kinds of political structures that pretend that they operate to the left, but actually continue to perpetuate rightist neoliberal policies? Finally, I want to wrap up by saying, one of my favorite authors is Arundhati Roy, who said during the pandemic, the pandemic is a portal for us to imagine new ways of organizing. And here we are, as we move into a different phase of the pandemic, seeing the ways in which the neoliberal ideology is being organized all over again through technology. So in that context, what does it mean to center ideas of justice in how we look at organizing data? And what does data justice look like? Thank you.
Great, thanks, Mohan. So much to think about there. Yeah, you're so right about the expulsion of the ability to actually do their jobs of caring for people that they're so good at is made more and more difficult by the technology. Yeah. I just wanted to, I guess, start off the panel discussion. If anyone in the audience has got any particular questions for the three panelists, because they've all got their own particular areas of expertise, which is really, really great, valuable to draw on. Mohan, Jan, and Andrea. I just thought I'd kick things off with you, Jan. I guess as a politician, as a member of parliament, any advice on where we go from here? How do we actually kind of change things in the context of, the 3-year electoral cycle, and that 1 year of that, the last year is basically just a year for campaigning where policies go out the window. Any advice there?
It sounds like you're onto it. I think it's the, you've got evidence-based, you've got compelling stories, you're spreading the word around that. And I think the next spaces for spreading that word further are hooking up some media and telling that story and getting in front of the politicians. And, everyone's thinking about what are their policies they're going to take to the election. Making sure that there's a sense of this is a live conversation in the community that people care about will definitely help assist in that struggle. It's, obviously I'm feeling enlisted and I hope if you hopefully we can get something in our policies around that, and then we can then work around that of once you've got parties to commit, to be able to kind of engage people around that. Yeah.
Hopefully Labour will be relying on the Greens to form the next government. Andrea, how do you kind of see, because I know you've kind of you have some good knowledge about the future of work and sort of current trends, and we're hearing a lot about AI and automation, and I've seen they're even kind of bringing in, I mean, the next logical step from this kind of automation in this sector is care robots, isn't it? Let's be frank. And I've seen they're already bringing those in Japan. How do you see this playing out in the future? Do you see care robots being introduced in New Zealand? And where do unions play a role in that, and maybe kind of fighting back against that?
Well, I'm not quite sure if you can unionize care robots. If they would be willing to join, I guess it depends on the algorithm that we apply. But, I don't think New Zealand is exempt from having care robots at some point in time. But as I said earlier, we all have an ability to make sure that we together shape the future that we want to see. And if that future doesn't feature care robots, we can make that happen. And I think it's very important to not think about technology as evil per se. It can really help and contribute to make work safer, to make it more decent, and also to create more dignified services. But as I said earlier, it's about including those who use the technology to actually shape it and influence it so it can be used in the interest of the worker and in the interest of the people that are cared for. I think that is the main point to consider. And I'm not quite sure if we can actually, as I said, if robots can become our members, but we should be looking into that possibly.
Just to speak to that, Andrea, there are sort of trials of different kinds of care robotics in New Zealand being undertaken. And I guess just to speak to your point, Andrea, is what's really important is in all of these kind of new trials, right from the stage of trial, that we are including clients, the people that are being cared for by these systems, but also people that are working in these systems. Internationally, there's studies in Japan and in the UK. So we sort of constantly see that there are impacts for workers when we introduce these new technologies. Often these impacts relate to more work that's work that's not being paid. And so it's right from the start, it's including these voices. I just want to talk about how important that really is.
Yeah, and your PhD, this is your time to plug your PhD, Lisa, is looking at this from the client's perspective. And we talked a lot about how crap this situation is for the worker, but it's what we can forget that how bad it is for the client as well. I don't know if you want to.
Yeah, so my PhD is looking at how older people themselves are using technology to care for each other, to care for their whānau, and to receive care themselves. And the issue here is that older people are not always getting a say in how these technologies are used. And this can be, in the context of medical professionals, it can be, being forced to use a health platform as part of your relationship with your doctor, and that creating lots of stress, real stress. But it can also be in the context of family, not getting a lot of choice about how you communicate with members of your family and the platforms that you use and how you're included in those conversations. And it's the same with support workers. And the sort of apps that you can use. There are real pressures. There are systems to learn. That takes time from people. It takes time for clients. And when we are excluding the voices of these people, we get the same problems over and over. It just like, if we can start Jolene's comment here, client voices really do need to be heard. We need to learn about their experiences and dealing with the people that are providing them care, because the clients too, they see how the support workers are being treated. They are on the receiving end of this inefficient care, and this is stressful for the home support workers too. It's awful to know that you can't provide the best care that you can because of factors well outside of your control.
Yeah, their ability to live in dignity, right? Everyone should be entitled to live in dignity, and that's being taken away from them by this.
Just on that, I was just at an event in Parliament around rare disorders, and there was a parent speaking with a very distressing story around her son's experience of not getting appropriate care, and that escalating into a situation where he ended up in prison and the family in breakdown. And a part of the story was where they managed to, after a lot of struggle, access home support. And she said, there were some caregivers who were really great and it made a huge difference, but then they left. Or that they would be, and there was just a real sense that for the family, that sense of kind of stability and well-being really was so dependent, and that has a trajectory that we often don't see or acknowledge as well. And we know that the staff feel the impact and the pressure of that. So I just, wanted to add that in.
No, that's great, Jan. Thanks. I know you mentioned sort of pay equity, and maybe that isn't quite enough in this case because it doesn't address those kind of deeper structural funding issues. Do you want to speak a bit more about that?
And Andrea might, I'm sure, add into this. It's probably more of the detail, but my sense of that is like when we got the first pay equity settlements, and there was a real sense of, this is a breakthrough moment of actually finally having a way to redress that imbalance, and as a society say, actually, we recognize that caring matters and needs to be valued. But we, in the debate around the legislation, we did have concerns at the time that people's hours might be cut back, and we were trying to send the message to the employers that that was not to happen, and that there would be consequences to that. And it was really gutting in this to read exactly those stories and people talking about not getting training to a higher level because they'd get their hours cut because the employer didn't want to be paying more. And I think it's also that none of the pay equity and the hourly rate cannot, or even the access to training, cannot compensate for a system that is founded on instability, precariousness, and treating people, I think, by virtue of that, as less than whole.
Yeah, Andrea, do you want to add?
Yeah, I think you explained it really well, Jen. I think what is important to consider in the context of home support workers or the care sector in general is that it's a female-dominated sector. And we all know that women are often disadvantaged when it comes to pay. And I would just like to underline that all of these care workers, all of these women care workers are actually worth 100%. And we just need to make sure that that is recognized financially. And as I mentioned earlier on, it would also help us with retention of really experienced workers, home support workers, as well as recruiting new ones as we need them in the future.
Yeah. I know that there's a recently like $750 million was found under the couch for the military because they're worried about retention. But yeah, it doesn't seem to be the same for anyone else in that kind of male-dominated sphere. If there are no other questions for the panelists, should we wrap it up? Or Jane and Michelle have got a couple more. Sorry.
I was just going to invite the panelists if they would like to offer any kind of closing reflections as we start to wrap up for the evening. I'm sure that everyone's getting a little tired.
Shall I give it a go? Start off? Yeah, cool. So again, a huge thank you for the report, a huge thank you for the webinar, and the biggest thank you to our members. I just, as a closing thought, I just would like to leave you with the urgency around creating dignified work for dignified services in home support and more generally in the care sector, because if we don't value and acknowledge our workers in that sector, we won't be set up for the future. We won't be able to have the communities we all want to live in and we all deserve to live in. So a focus on home support workers and the community sector or care sector more broadly is absolutely needed. And our workers deserve it, and all our people here in New Zealand deserve it as well who use the services. So thank you very much for this important report and for this important kōrero.
Thank you. Yeah, Jan, do you want to add your last thoughts?
Just make it hopefully super short, but thank you for everyone who contributed and for the researchers and the people that supported it. Really, really important to me. And it is, I think, a real call to action and a challenge for everybody in this place of Parliament to work out actually how do we just, start again and make sure that we've got a kind of a system that is humane and human-centered, because what comes through from this is that it's not, and that has a really negative consequence for people doing the work, and we know that that will have an impact on the people that you're caring for, and we need better.
Great, thanks, Jan. Mohan, do you want to wrap it up?
Thank you so much for centering humanity, dignity, care, the labor at the heart of organizing digital and platform work. I think this offers a basis for thinking about a variety of different kinds of work and how we conceptualize AI futures. And along those lines, perhaps there is much more room for us to really think about innovations around ideas of worker-owned platforms, platform cooperatives, technologies that are owned by workers and things such as that. And there are similar innovations that are happening globally. And perhaps this is part of a global solidarity building in terms of really thinking about radical transformations in how technologies are organized. Excited to see this interface between research, union organizing, and politics, and really wish you all the best going forward.
Fantastic. Thank you very much to the panelists, and thank you to all the home support workers in the audience and other people that came along. And just, yeah, keep in touch. We've hopefully got an article coming out in the conversation later on in the week. So that's going to be hopefully getting out in the media, and we'll be in touch for further actions. Thank you very much, everyone.
Kia ora. Thank you all so much. Thanks to the panelists and the attendees. Ka kite. Good night.